Viti, during your oral examination, I noticed quite a lot of plaque buildup on the top surfaces of your brackets. Have you been noticing that?
Yeah, kind of, but I just don't have time to brush them.
Yeah, I also had braces when I was a teenager, and I remember how long it took to make sure all of my brackets were clean.
Yeah.
But do you know what it is? It's actually getting built up on your brackets.
I don't know, I think it's food. I don't know what
Right.
else it could be.
So when you're not brushing very well, you don't completely remove all of that food. What happens is that you have bacteria that adhere to your teeth. So what they're going to do when they see that food, they're going to feast on it. And so those readily available nutrients that are stuck in your teeth, the bacteria is going to feast on them. And eventually what's going to do is start to demineralize your enamel of your teeth, which eventually will lead to dental caries. So it's very important that you brush good and get all of that food out.
Okay, I didn't know that.
Really?
No.
Yep, so it's pretty good that you need to brush all your teeth, and also it helps with your breath. Because what causes the bad breath is the bacteria that gets caught up in your teeth. And so when you brush all that, not only do you clear your teeth of the bad bacteria, but you're also getting fresh smelling breath.
Oh, okay. I just thought toothbrushing was for your breath. I didn't know.
Well, it's twofold. Good breath and nice clean teeth with no cavities.
Oh, okay.
So would you like me to show you a technique that's going to help you reduce the plaque on your braces?
Sure.
Okay, this is called the Charters technique. What you want to do is place your toothbrush at a 45-degree angle towards the chewing surfaces of your teeth. That way it's also on the gum line and it's on the brackets. You're going to use a soft, circular, vibrating motion across the teeth, so you're stimulating the gums and you're removing that plaque. You're going to do that all the way across the top arch and the bottom arch. Get those brackets really clean. And you're going to want to do this for 2 minutes. It's really better to do it for 4 minutes. But I know that you're a teenager and you always have things to do, so you don't have a lot of time. So definitely try 2 minutes for me, okay?
Okay.
And also, your tongue, you're going to want to brush your tongue really good, because that's another reason that sometimes you have bad breath, is because your tongue. You want to make sure you get it really good. And replace your toothbrush every 2 to 3 or 3 to 4 months. Another thing that's good is it's a compact brush, compact tuft brush, and it's really good for getting in between the brackets. Since it's a really small brush, it's going to help you reduce that plaque. So do you think you can do that for me?
Sure, I'm going to try.
Okay, thank you.
So, Miss Larry, when we went over your health questionnaire, you stated that you have diabetes and you have never done prophylaxis before. And also, after I examined your teeth and saw your x-ray, I diagnosed you with moderate periodontal diseases, which it may cause by many different factors, like not brushing your teeth correctly or not maintaining your oral health effectively, or in your case it might be because of the diabetic that you have. One method that really reduces the oral health diseases is brushing. Brushing really helps you to avoid any plaque buildup. Do you know what's plaque?
Not really.
So plaque is the bacteria that build up in your mouth and they feed out of the food that you eat. So if you brush your teeth effectively and correctly every time, you interfere with their build-up, and so they cannot cause any problem for your teeth. Earlier I also give you a disclosing solution, and if you see it in your teeth, all the red spots are the plaque. And yes, those are our plaques that it's because you didn't brush your teeth very well.
Man, I thought I'd been brushing pretty good. I guess not.
Yeah, because brushing is a technique that you need to learn, and I will teach you today.
Okay.
So first, let's start that what kind of brushes can you afford financially?
I just buy the cheap manual ones. I don't have a lot of money.
Okay, that sounds good. So in this case, I will recommend you a brush with the soft or extra soft bristles, because it's more effective on the cervical area of the teeth, both marginal and interproximal. In other words, it's effective on the area between the teeth and between the gum and your teeth.
Okay.
So it also helps you, and I want you to get a brush with a narrow head, so the head is or tapered filaments, because it's easier to clean the area between the gum and the teeth.
Okay.
Additionally, I would recommend you to buy a brush that has a tongue cleaner on the other side of the bristle.
Okay.
In here, that whenever you brush your teeth, I want you to use it on your tongue like 3 to 4 times, because that way you also can avoid the plaque buildup in your tongue, which eventually it may cause you to maintain your oral health better.
Okay.
So let's start with the technique and brushing methods. There are many techniques for the brushing, but not all of them are suitable for every person. In your case, I chose bass technique for you because it's easier to use, and you can maintain your oral health and also clean the underneath the gum and the teeth, which in your case it's better to clean that area because you have periodontal diseases. So for this technique, you need to place your brush in a 45-degree angulation with the long axis of the tooth like that, and then gently push the filaments. Actually, when you put this in a 45 degrees, the filaments gently goes inside the sulcus between the teeth and the gum. And when you have that, just jiggle it in a horizontal movement, very short ones like that, and then move to the next 2 teeth. I want you to do this on each 2 teeth for 3 to 4 times, to repeat it 3 to 4 times like that. And then when you are done with this side, I want you to go to the lingual side and do the same thing on the lingual side of your teeth like that.
Okay.
When you are done with the upper arch or the upper jaw, I want you to go to the lower jaw and then go to the lingual, because that way you wouldn't miss any teeth. So and I would recommend you to do this 2 times a day and at least 3 to 4 minutes. I know it sounds like too much, but it's better to have a good oral health, and to avoid more periodontal diseases, to cause it to get more. And I also recommend you to change your brush every 2 to 3 months.
Okay.
So, do you think we can do this?
Yeah, I think so. I'll definitely try.
Good. So, I will see you in 3 months.
Okay, thank you. Go.
Zahar, I noticed that you had an accident a month ago.
Yes.
And how's that working out for you?
After the accident, I cannot move my wrist very well, and so I'm going to therapy for this, but still I have problem with brushing.
Oh, okay. Because I noticed that you have a lot of plaque buildup on your back, in the back of your molars. And do you know what plaque buildup is?
No, I have no idea.
Okay, plaque buildup is when you eat your food, it gets stuck in your teeth, and when you don't brush correctly, the bacteria feed off of it. So that causes plaque, and that can later on lead to cavities, and it's really bad. So I know that you have it because you can't really brush your teeth very well. So I'm going to teach you an easy method that will help you. Do you want to learn that method? Do you want to see if it'll work for you?
Oh, sure.
Okay. So what you're going to do, you're going to hold your toothbrush like this, like so, and you're going to do horizontal strokes. This is called the horizontal method. And you're going to hold your teeth and you're just going to do long strokes. That way you're not rotating, that way it's just straight across, and you're going to make sure you're going to go up, middle, and down. All the way across. All the way across. And you're going to do the same thing with your linguals. You're going to go in and you're going to do straight across, because what we're trying to avoid is you rotate that wrist. And then make sure that you clean your tongue. You're going to do long strokes across your tongue as well. And that's for bad breath or anything you see white on your tongue. That's like plaque, it's dirty. It's similar to plaque, but it's not plaque. It's just bacteria that's building up on your tongue. So you want to make sure you can do that. I can give you some tongue cleaners to see if you can try those out as well. And do you, what kind of brush do you use? Do you use a soft or a hard bristle brush?
I use a medium.
Medium? Try using a soft bristle brush because the horizontal method can be abrasive to your gums. So we want to try to do a soft bristle brush, and you want to make sure you want to change it out every 3 to 4 months. So that way you're getting the best clean possible. And do you understand that? Is that okay for you?
Oh yes. And how many minutes did you say that I need to
you
do?
should definitely brush your teeth at least 3 minutes. We know it's a long time. Some people only do 2, but try to do it between 2 to 4 minutes. So I try to tell my patients 3.
Okay.
Okay, is that okay for you?
Yes.
Yeah, you think you can do that?
I think I can do that.
And if there's any discomfort while you're brushing, you can always give me a call, and we can find a different method for you.
Oh sure,
Okay?
thank you.
You're welcome.